Welcome to MWEB's Entrepreneur Zone. I've got Mogale from ClearScan Medical with me today. Welcome.
Thank you.
Tell us a little bit about your business.
Well, the business we want to bring to South Africa is a mobile radiology service, which we believe there's a big market for, and we want to bring vehicles to where people are to get them diagnostic care.
Tell us how you came up with this concept.
Well, my brother is a practicing radiologist, and while he was doing his studying and becoming a doctor, he found that in the middle of Middelburg in Mpumalanga, there wasn't any high-end radiology services, things like CT and MRI, and it doesn't make sense for people not to have that type of care. And we thought, what's the best solution in South Africa? To take the asset to where people are, and that made the most sense, rather than having people come all the way across to an asset.
And for you it's a change, you're not from a medical background?
No, I'm from an architectural background, so I lived in and out of building sites, and of course office, where I used to draw all the drawings and make inspections on sites. And I decided some time ago that it's time to make a change, and I think it's been a very good change. And
the business model, how do you generate revenue out of it?
Well, we make revenue from fees. We would be paid per patient. There's also a capitation model where we'll be paid a budget to cover a certain amount of the population. So in essence, in radiology, currently in private radiology, you do an image and a report, and you get paid a fee that's been agreed with the medical aids for that work.
And you've got two models. One is where you have a location currently, and then you have another model which will be involving a mobile unit. Tell us about your current existing unit.
Well, what we're doing in Soweto is that what we want to implement are all the softer service sections of our mobile business that we're going to bring in the future. So what we've got is a service to cash patients and to medical aid patients in Soweto. And so what we do is pick them up from their doctors, who give us a referral form. We image on site and report via teleradiology. So a person reports off site. I think all the Medicrosses work on the same basis, and then the doctor gets issued with a report, and the patient goes to their doctor with a printed out X-ray.
How have you gone to market with this concept?
Well, the mobile concept, we have spoken to a lot of medical aids, a lot of corporates and wellness companies. In essence, what we need is a groundswell, and we need a mechanism to go to corporates, to go to patients that are part of medical aid schemes, and also to go to government. So we have met quite a lot of people in private and public health care in terms of rolling out the mobile business. And on the fixed business, what we did is, like all businesses, went to the bank, got a loan, and we bought equipment. We've got staff now, and what we do is we offer the service to the people that really require the service, and we believe we offer it the most efficient service possible for what we do in Soweto.
And in terms of pricing, how have you managed that?
Okay, well, our model is based on the premise that you must charge lower fees. Healthcare, just like law, has become more and more unaffordable as far as we care to think about it. So what we're saying is we charge a flat rate for whatever imaging you require X-ray wise. So we charge a flat rate. So whether it's an arm or your chest, we charge you 200 Rand for the image plus the report to the doctor. So the model is based on volume, and that's where we're headed towards now. So we initially used to do about 2 patients a day, and now quite happily we're doing about 10 to 12 patients a day.
The business that you've got into is capital intensive. It's not cheap to buy the machinery that you need. How have you managed your cash flow?
Well, the cash flow has been pretty tough for us right now, honestly. So what's happening, of course, the income coming into the business is not enough to pay for the cost of the business. So yes, like every entrepreneur, what you try and do with the invoices coming in is talk to your suppliers to say, can I pay you within 60 days or 90 days for the same invoice? That's how we're managing it. So of course, yes, and also what we have inputted quite a lot of cash into the business on a monthly basis to make sure that we're covering all our costs.
One of the secrets to being a successful entrepreneur is to find a problem and then to find a solution. And that's exactly what you guys have done.
Yeah. So what we want to do is solve a massive problem in a budget in a low-income family or middle-income family. You're spending a lot of money accessing healthcare, and you're spending a lot of money on food and getting by. So that's why one of the solutions we have implemented in Soweto is to offer free transport to patients. So we will get a call from the doctor, we will go and pick up the patient, bring them for x-ray and take them back to the doctor free of charge. What we also want to make sure is that the contact between ourselves as a service and the patient is the best it can possibly be. So an example is a spa environment or a hotel environment, to say the people that are giving you the service actually have to care. So the scripts have gone away. We did a lot of typing of the scripts, what to say or what not to say, but you have to genuinely say, how can I help you? The smile is important. To say, okay, I'm here to help you. Please give me a referral form. Simple things. Please come through, man. So those are the things that we're implementing. And the problem is that there isn't very good service that we feel at the low end of the market in terms of the low income people. And we have to give more away, in essence, for free in order to solve their budgetary restraints.
In terms of providing that service, what sort of staff do you employ and how do you train them and get the passion that you have across to them?
Okay, it's a good question. Before we started, the reception staff went to a training institution for receptionists. The driver went on to I think one of these high quality driving courses. The radiographers are already fully trained. I didn't need to train them anymore, but what we're going to implement this year is that we're going to pay for any seminars that they go to throughout the year. And the tea lady, she went to, for somebody came in-house to train her on how to serve certain beverages, and also how and when to clean certain services and certain places in the business. And what I say almost on a weekly basis that is, when somebody's not well, you can't make them worse by giving them a bad service. So we are here to make their experience as quick and as efficient as possible and as welcoming as we can be, to try and improve their state mentally, if anything else.
The problem that you guys are addressing is one that exists throughout the country, and presumably there's an opportunity for you to work with government to bring the service.
Yes. Now, for us, there's a massive opportunity, and that's why we need to be efficient in how the model works. So what we've done is try to separate out the model. So there's the asset, the vehicle that has the equipment on it. There's the staff members that will be on the vehicle, and of course the technology connecting up to the vehicle, plus the people reporting. So radiologists and the radiographers are the two quite important people, and we need to get through as many cases on a single vehicle as much as possible, and we need the radiologists ready to report as many cases as possible. So the asset going around the country, the vehicle, the truck going around the country, doing as many cases as possible, transmitting them to somebody who can report. That person does not need to be on the vehicle. So that's how we believe the model will work at its optimum, if you separate out and make each component efficient.
What's the challenges of trying to sell this concept into the government or into local authorities?
Yeah, I think the biggest issue has been for us in that we need to have cohesion in terms of how they run their system. If we're going to plug into it, they need to tell us how and when and to what extent we're going to plug in. One fear has been that we will be too efficient and introduce too many cases into the system which cannot cope with it. So what we've always said, and what we also saying to the private sector in terms of, let's say, breast cancer, that you need to have early detection. You can't say you can't have early detection because you're going to increase patients. People need to be cared for the best way possible. So what we're introducing is a mechanism, whether private or public, that we can offer a service efficiently to the public sector and not be a threat to them. So for us, the costs, yes, are a big issue. So they need to have, they've had some years now to chew on it, to say, okay, how can we introduce this service? Yes, it's going to be increasing our costs, but one thing it's going to be doing is offering a service to locations that didn't previously have the service.
Another area obviously is with proactive care within medical aid schemes.
Correct.
Is this an area that you've explored?
Yes, that's why we want to do mammograms, which is a screening imaging service, that what we want to be is a proactive service. So we want to work with medical aids, we want to work with hospital groups, with doctors, with the medical fraternity to pick up ailments very early. Yes, one of the benefits is that you can deal with them much quicker, and the other one, of course, there's a much smaller cost to the medical aid scheme as a total and the individual member. That if you are picking up something early, dealing with it early, you're not going to have a problem 10 years from now where you might have to remove parts of your breast.
In your experience of having to deal, obviously trying to deal with government, with local authorities and with big insurance and medical aid schemes, what are some of the learnings you've gained?
Yes. Well, one thing of course is how to interact with people. I believe being honest is the best way forward. Never oversell yourself. So one comment that did come up, where's the vehicle? We don't have a vehicle. So always be very honest and upfront with that. It takes a long time to make the vehicle, specially made. And the other thing is you got to be a team player. You got to say, what is it that we can do for you? Right now you might have an opening. Right now you might have a gap in a service. You might have a gap in a region. That's how we approach. So we would go out, let's say, to KZN and say, okay, where do you think would be best for our type of service? Those are the kind of things that I've learned to say, don't just sell something to someone. Wait for them to say to you, okay, this sounds like a good service. Let me think about how I can make use of it. And so in the case of hopefully the contract we're going to finalize shortly, we didn't need to sell to them. They already knew the problem, but they had nobody to give them a service. And here we came about a week and a half later, and they were very welcoming.
It must be rewarding for you as an entrepreneur when you see the impact that you have on people's lives.
Yes. Well, that's exactly why patients should be at the core of the business. They matter most. Whatever we can do to make their lives better is why we are around, why I wake up every single day. So I even said that on Twitter today, that I'm happy in trying to give the best service possible. Yes, some comments we've gotten from patients, they couldn't believe it. Is everything finished? Is everything in there? Let me open the envelope to check that the X-ray is there. I can't believe we get this kind of service in Soweto. Those are the kind of comments we've had. So for us, the experience, yes, has been quite overwhelming in terms of response of patients. And currently we're headed up towards about 800 patients that we've had through the practice. So we're very happy to make other people happy.
And where to next for your business?
Well, in about a year or two's time, I believe we'd have a few vehicles on the ground to offer this mobile service. And also we believe we could be probably to 3 to 5 more sites, fixed sites in townships, giving this type of service, which is, which we think is a doable target.
That brings us on to the rapid fire questions. What's the best advice you've received?
Be patient.
And your best moment as an entrepreneur?
Seeing the first patient leave our premises in Soweto.
And your biggest mistake?
The biggest mistake was believing that I could do it all, the admin and everything, and I've gotten behind a little bit, need to catch up.
What do you look for in people that you work with?
Yeah, people that care about other people, not about themselves.
What does an entrepreneur need to succeed?
Persistence.
What's your biggest inspiration as a small business owner?
I think my brother is. We'll own the businesses together in the future, and he works very hard on the goal that we headed towards.
What would you do differently?
Nothing.
What makes South Africa a good place to be a small business owner?
There's massive amounts of opportunity around every single corner.
What keeps you up at night?
Need more cash in my bank.
And what gets you going in the morning?
My son, and the belief that today will be a better day than yesterday.
Thank you very much for joining us.
Thank you.
And thank you. We look forward to the coming weeks. We will bring you other South African entrepreneurs. I'm Paul Hoblin. Thank you and goodbye.